Breast self-examination. Observing the breasts. First, stand in front of a mirror so that you can see at least up to your neck and down to your waist. Now, keeping your hands on your hips, look at the size and shape of each breast. If you notice any changes, you need to consult a doctor. But do remember that it is not unusual for one breast to be larger than the other. Look also for any puckering, dimpling, or any other changes in your skin. Now look at your nipples. Is there any change in the position of either nipple? Also, look for any retraction of the nipples or discharge from them. If you have large breasts, lift them up slightly to examine them underneath. Again, look for any changes in the skin here. Now raise your arms over your head and look for similar skin and nipple changes. Continue the examination with your hands clasped behind your neck, pressing them forward and tightening your chest muscles. Finally, place your hands on your hips, press down and in, and look again for any changes in your nipples and skin. Feeling the breasts. Lie down and place a folded towel under your shoulder on the side you're going to examine first. Raise your arm under which you have placed the towel. You may find it most comfortable to place your hand under your head. The area you will examine includes not only your breast, but also the area up to your collarbone, as well as below your breast, across to the breastbone, and over to your armpit. Using the pads of your first 3 fingers, begin to examine your breast using a series of small circular motions, each about the size of a rupee coin. You should use 3 levels of pressure: light, medium, and firm. This way, you can feel the different layers of breast tissue. Using this technique, trace a series of vertical strips moving from the collarbone to below the breast and back up again in zigzags until you cover the entire area. You may also use a technique where you trace a series of concentric circles towards your nipple, or a method where you cover the area through a series of wedges. Use the pattern that you're most comfortable with. But the most important thing is to cover the entire area of the breast. Also, squeeze the nipple gently and see if there is any discharge. If there is any discharge, please see your doctor. Now repeat the entire process on your other side by placing the folded towel under the opposite shoulder.
Okay, that didn't seem so difficult.
Not difficult at all, Dipali, but you need to know how to do it correctly and effectively. Get the feel of your normal breast and then look for abnormalities.
And if you find any change in the shape of your breast, any skin discoloration, any lump or thickening in your breast or underarm, or any changes in the shape of your nipple like puckering, retraction, or nipple discharge, you must see your doctor immediately.
Now, a self-exam needs to be done regularly after the age of 20. After the age of 30, in addition to this, you need to get a clinical breast examination done by a doctor.
Oh yes, my cousin said she gets a gynae to check her breasts.
Exactly, the doctor is more likely to pick up an abnormality if there's one.
So do I need both a self-exam and a clinical exam?
A self-exam once a month and a clinical exam once a year, that's all.
But after the age of 40, women have to be extra careful because with rising age, the risk increases.
That's right. That's when you need a regular mammogram.
Oh God, I've heard mammograms are really painful. A friend of mine was saying that your breast gets squashed so badly, it hurts horribly.
Did your friend say this after getting her mammogram done?
Well, no, she had also heard about it.
Well, Dipali, I get regular mammograms done and I can assure you it's painless.
Some women may feel little discomfort, but the thousands of women who have undergone mammography in my clinic never ever complain of pain, let alone acute pain.
It is advisable to get your mammogram done a few days after your periods.
So what happens in a mammogram?
Dipali, this is just an X-ray of the breast, which we do with the help of a specially designed machine to do that. A mammogram can pick up a tumor much before it can be felt. It also shows few deposition of calcium, which we use the word microcalcification, which is also indicator of early breast cancer. But these mammograms must be interpreted by a trained radiologist only.
That looks like a lot of radiation. Isn't that itself a cancer risk?
That's a complete myth. The risk from radiation is negligible.
Dipali, the studies have shown that all of us are exposed to background radiation, which is equivalent to 4 mammograms a year.
The benefits of an annual mammogram far outweigh the risks associated with it.
In some cases, mammography is not clear enough. That happens usually in a younger woman or woman having a dense breast. In these cases, we also do an ultrasound.
And if a lump is found, it may require a biopsy. This is done by extracting a piece of tissue using a needle put into the lump. And this is called a fine needle aspiration or a needle biopsy.
That needle procedure looked really painful.
It's only a needle prick, my dear, and it can save your life.
All these tests have only one aim: early detection.